Dear watchers, let me share with you with my latest movie. During it, I want to share with you with my experience in repair problems with the pupil. First case is the congenital coloboma. Patient decide for the surgery because he didn't accept the shape of his pupil. During the surgery, I tried to close the lower part of the pupil and to try to gain a round shape of it. During the surgery, I don't want to show you all etaps of the surgery, but only to show you that we can do it. The difficulty of the surgery was the presence of natural crystalline lens with safe accommodation, and when I do such surgery, I have to be very careful to avoid touching the lens. The patient is very young, about 30, and touching the lens can cause need to or lens removal. This is the last moment of the surgery. I try to close the cornea once by hydration, and the second surgery is the eye after blunt trauma. After it, the vitreous partially goes to the anterior chamber, and the sphincter of the pupil was also damaged, so the patient has photophobia. He decided to do something, and I advise him to remove the vitreous from the anterior chamber and to decrease the size of the pupil by applying a continuous suture. This is the etaps of the all etaps of the surgery. First, after staining the vitreous using triamcinolone, I remove the vitreous, and after it I can start to decrease the size of the pupil by applying the stitches around the margin of the pupil. In my opinion, the difficulty of the surgery is not only avoiding to touch the lens, but also to gain required shape and the size of the pupil. But as you see, the surgery was finished with a good result. The shape, the size of the pupil was decreased, and the shape is looks like a round. And the last case, in my opinion, one of the most interesting, eye after the surgery. Because of the retinal detachment, some of doctors try to touch the retina, but with bad result. The retina was still detached, and during the surgery the lens was also replaced, and the patient, because of the brown color of the eye, decided for doing something. He wanted to had injected artificial iris, but I after examination of his eye, I decided to do something different. You see this brown color is the presence of the epithelium on the surface of the iris, and this surgery will be consist of two etaps. First etap will be removal of this brown epithelium, as you see now, and after it I try to decrease the size of the pupil by applying stitches like you see in the previous movie on the margin of this iris. Because the shape of the iris was not very round, I decided to apply another stitches to correct the shape. And as you see now, this eye started to looks like a normal, with a normal color and normal shape of the pupil. What is important, take a message for you, is that when you have a natural tissue of the iris, you shouldn't use any artificial irises, but only try to use this natural tissue. This is the last moments of the surgery. I try to remove this dye, and after it I will close these corneal ones. So this is the last moments, closing of the corneal ones. The pressure in the eye was very good, and I can finish this surgery. Thank you for your attention, and if you have any problem with iris, I can recommend to contact with my